Okay, so hello everybody, and welcome to my lovely guest today, Dr. Pina LoGiudice. Hi, Pina.
Hello, thanks for having me.
So happy to have you, and we're going to get right into this. But I want to tell everybody who you are and why I felt like it was important to interview you and how you could really shed some light on what's going on and help us right now. So, Dr. Pina LoGiudice is heralded by Dr. Oz as a world expert in natural medicine. She also is the co-founder of InnerSource Natural Health and Acupuncture, and she's author of a book called The Little Book of Healthy Beauty, Simple Daily Habits to Get You Glowing. So that's I mean, seriously amazing. And I know that that book was endorsed by Dr. Oz. So I really, before, I start, asking you about some tips and how you can help us, I wanted you to explain to people, like, what is a naturopath?
Sure. Yeah. Thank you so much again for having me, Wendy. I'm so thrilled and honored to be here. Yeah, many people are confused about what is a naturopathic doctor, because when I say that, they're like, is that an osteopath? And so the best way that I explain it is that there are three types of physicians in the United States. There's the MD, which is known as an allopath. There's the DO, which is an osteopath, and then us, an ND, which is the naturopath. So the basic sciences of our medical school is the same. So it's the same anatomy, physiology, pharmacology. So all of that basic science stuff is the same. And then we differentiate in terms of then philosophy on how the body works. So an MD, an allopath, believes in a very system-based medicine. So that's why you have the different specialists. You have, let's say, the gastroenterologist, the rheumatologist, the immunologist, the gynecologist. So you're basically broken up into parts. Where an osteopath, you think of bone. So their initial philosophy is that if the musculoskeletal system isn't in alignment, then the nerves can't feed the organs and joints, and that's how they believe that disease can manifest. So initially, in a lot of the training in osteopathic school, they learned a lot of like chiropractic manipulation. So things are very similar in terms of adjustments when you see a true osteopath. And then for us as a naturopath, we see the human body as a complete whole, mind, body, spirit. You're not broken up into parts. It's about you as a system, emotionally, spiritually, physically. And what we try to do is look at the underlying imbalances in your body and trying to heal the body using natural means. Because with regards to conventional medicine, their philosophy is to suppress body systems. And our philosophy is the opposite, is that it's not about shutting things off. It's about putting things back in balance that allows the body to heal. So that's the difference between the three doctors. And I think a lot of people feel confused now because a lot of the DOs are, function very similarly as an MD, because you can have an osteopath as your gynecologist. So when you think about the initial training, you're like, well, that's a little weird. But it's just now those two medical schools are a lot more in alignment, and it's really then us that's the different group of people. So, and then, with regards to the different states, not every state recognizes naturopathic medicine. So where I went to medical school in Seattle, Washington, I'm trained as a primary care physician. So if you're not feeling good, or even up in Connecticut for that matter, you could see me as your primary care doctor. So, because again, we're trained in antibiotic use, we're trained in some medical procedures like minor surgery. So we all have that training, but here in New York, the states that don't recognize natural medicine, we can't obviously do those things. So that's where if you don't mind me doing a little plug for our New York Naturopathic Association, because we are trying to get licensure here in New York, and especially in light of what's going on with this pandemic, that naturopathic medicine is where I really believe that people gain the best benefit with regards to preventative care. So if we could help support us, our Naturopathic Association, that would be amazing.
So for me personally, I've experienced your practice and I've experienced what naturopathic medicine is, and it's in my mind, it's the only way to have a doctor and to see, to get the help you need. I came to your practice a couple of years ago because I had an allergic reaction to an antibiotic, and I was so impressed. I was sitting across from you guys and I was like, this is how medicine should be practiced. You were asking me questions like, how much are you sleeping, and what were you thinking, and do you meditate? And you really like collected an entire picture of me as a human, like a holistic approach. And I, I remember sitting there thinking, oh my God, this is what I've been missing in medicine. So what can we do to support that? Like what you said, you know, how, is there
Yeah, I
any
mean, really the easiest thing is about, just like with anything, it's about calling your assemblyman and congressman and saying, hey, I think naturopathic medicine is essential here in New York, and I want these doctors licensed. So I know our New York Naturopathic Association, which the website is nyanp.org, and we're always putting out blasts as to when to call your legislators to say, I do think it's important for us New Yorkers to have us licensed here. I mean, right across the border in Connecticut, people can see us and be covered by insurance and choose us as a way of their health care. So it's been a huge fight. I've been in practice for almost 16 years here in New York, and every year we are fighting. And, and there are a lot of, legislators that are in support and do believe that naturopathic medicine is essential here in New York and essential for New Yorkers, but there's always some sort of glitch there that they just don't allow the law to pass. So again, just if you could log on to that website, or you could always email me. I'm more than happy to get you connected to help give us support.
Well, I'm definitely going to do that.
Thank
So
you.
now let's get to some tips. If you can share with us a holistic approach to getting through this time in our lives.
Yeah, I mean, obviously this pandemic, everyone, the biggest issue is fear. Because when you hear something like this, that, people are dying and getting gravely ill, what happens to every human, because again, we still are animals, that our amygdala, which is our primitive brain, gets triggered and like, okay, what do I need to do to be safe? So of course, our stress response is going to get heightened. So, with that, it's the first problem I see is that our stress hormone, which comes from our adrenal glands that sit on our kidneys, raises a hormone called cortisol. And when cortisol is elevating, that's when you're going to start seeing a lowering of your immune system. So really the first thing I always say is you really are safe. If you stay at home and you wash your hands and it's really common sense procedure, you're going to be fine. So the first thing is always to keep your psychology balanced and know that you really are safe and okay. And, from my standpoint, I think the issue is that when you look at the media, a lot of the conversations is like, well, we don't know what to do. We don't know how to help people. So there's like, well, maybe there's this drug, or maybe there's this vaccine coming and all these other things. But when you actually look at the research, the people who are healthier and have a higher antioxidant status do great. They may get a little cold, they may not feel good, but that would happen any time of year. But you do fine, and you're not going to die that way. So from my standpoint, it's keeping the stress low. And then, now is a great time to access, the great things that Mother Nature gave us to get your body healthy. It's about being proactive and not reactive with regards to your healthcare. And I think that people who are sick with the COVID and in the hospital, unfortunately are in that reactionary response because they have the heart disease, they have the diabetes, they've been smokers, and they've had all these chronic issues that now I think, unfortunately, that status of antioxidants is really failing them. And that's the unfortunate piece. So I feel actually empowered because I know with my patient base and knockwood, thankfully all of our patients have done really well. And even our Manhattan patients who have come down or tested positive with COVID, they get sick, we're getting them through with natural therapies, and they're fine. So I think it's understanding that you do have power and you do have control. And I think once you understand that you have the ability to take charge of your health, there's nothing more grounding and powerful than that.
No, that's totally true. And you're right. What you're saying, it's like treating wellness, not illness. Not treating people only when they're sick, like treating them when they're well to stay well. And that's something you do so well.
Yeah, and I think that's the wrong philosophy that we've had in this country for a long time. You know, there's a saying that in Asian cultures that doctors actually stop getting paid when their patient gets sick. So, so we're here, it's like, well, we don't take care of ourselves, or we don't actually, you know, when we don't feel good or when we feel pain, that's when we actually take action and do something. And again, that's not the key to longevity. It's also it's understanding that if you don't have health, you don't have anything. And so I think with this virus going around, it's a huge reminder that, you know, above anything, you know, your health is number one, because then you can't travel the world and you can't go see your friends and you can't do all those things that you want to do if you're not well. And there's so many things in the world of natural medicine that allows the body to heal, because I think one of the other misconceptions is that people feel that the body can't heal without drugs, or the body doesn't know how to do that, and it's the furthest thing from the truth. Like, one of our basic philosophies in my medical school is that the body always wants to go back into balance. It always wants to go back into homeostasis, and once you give it the opportunities, it will. Like, again, I've had 15 years worth of patient space, thousands of people that we've seen that, you know, come in with various autoimmune diseases or allergic reactions like you, or digestive diseases or migraines or infertility or, you know, hormonal imbalances. They think, well, you know, and many doctors, and even myself included growing up, was like, well, I have this issue. And they're like, well, this is going to be your life. And it doesn't have to be. So the body wants to heal and can, once you give it the right opportunities.
And that's the thing. That's where you are this amazing guide, you and your practice, because you're able to, you know, you even, I mean, you looked at the vitamins I was taking and the supplements, and you said, you added some, you kept some. And so we need a guide. Like, you are a trained doctor, you're able to do that. And so, and that's so important, to find that right person who can really help you and give you the right information.
Yeah, I agree, because it's really, you know, what we do, you know, again, not to, I'm not, you know, this is not about, you know, conventional medicine or natural medicine. It's just that, you know, our philosophy and our practice, with whether it's myself or any other docs that work with me, it's like, we're your partner. We're, you know, we're your advocate. So, I mean, you yourself are your ultimate healer, because you know your body best and you know your psychology best, you know, and we try to provide the best information to help be that support system with you. So I think that's one thing that I know our patients in our practice really appreciate, because you don't feel alone that way. You don't have to feel like, I got to figure this out myself because no one's hearing me speak, or I have a, you know, a 2-minute appointment with the doctor, and how they're going to figure me out in 2 minutes. So, yeah, so we really enjoy being part of, you know, someone's life, if you will, as an advocate.
Yeah, I love that. And so in this time, Dr. Pina, like, what do you recommend? You know, there's such a controversy about elderberry. I'd like you to talk a little bit about that, and then tell us, you know, what you do recommend people taking to keep their immunity high.
Sure, of course. You know, of course, the first is going to be my initial disclaimer, because obviously people are on multiple medications and whatnot, and you would like to consult somebody, you know, so this is not you know, so just be mindful of yourself, and try to speak to someone if you can. But, you know, one of the big things that I don't know how, I don't even know where this got started, but it completely exploded, that elderberry, which is this beautiful plant in the natural medicine world that, you know, a lot of people who are holistically minded use for as an antiviral. And elderberry has been shown in research to actually fight the H1N1 virus better than anything else. So some information came out that elderberry induced what's called a cytokine storm. And if you've done any reading on COVID, one of the things that have been making people more sick is that this cytokine, where it's basically your immune system becomes like crazy, and it's like basically like a storm where the hail comes in and really damages the lungs in the body. And so somehow it got connected that elderberry, if you take it, can create more of this cytokine storm, which obviously was very frightening for people. But, you know, I've spoken to my colleagues around the country, and we've had numerous conferences within our community about it. and elderberry is safe and fine. So absolutely, as a means of prevention, I do recommend elderberry still to this day. I take it with my own family and my daughter, and I do think it's a beautiful, beautiful botanical that does absolutely help the immune system. So other things that I do recommend, again, is like I mentioned before, it's about antioxidant status and taking things that help the immune system function better and increase our level of antioxidants. So there are basic things that people can get anywhere. You know, vitamin C is a great one, vitamin A, vitamin D. So those basic simple vitamins that way will increase our immune system. And you know, vitamin D is a really important one because most people have lower functioning and they think, well, you know, if my value is just around 30, my doctor says it's enough. But really at this time, you do want to keep your blood values higher than what you normally would. Obviously not in an unsafe range, but if you do 2,000 a day or 5,000 a day, that's plenty with food. Zinc is a great nutrient for immune boosting. Usually I recommend around 30 milligrams a day of that. Omega oils are super important, so those essential fatty acids. And I'm just listing down, it doesn't mean you necessarily have to take the laundry list, but you know, these are the things off the top of my head that I've been recommending. Selenium is a great mineral that they're finding that too is also great at preventing COVID from adhering to your cells. So selenium is a great one. Usually one capsule of 200 micrograms is sufficient. I'm trying to think of what's in my pantry that else I've been taking, but usually, and then you can get into the world of botanicals that, you know, there are beautiful antivirals like licorice or olive leaf or mushrooms and garlic and onions, like things food-based. That's very important that you can get because obviously not everyone can run out to the store and get the vitamins, but you know, Mother Nature provided for us 100%. So through foods, you can get all these great immune enhancing botanicals. And usually with the botanicals too, like if you're looking things at like andrographis or olive leaf or anything else, I just say, you know, start those if you're really not feeling well. Like you want to use them when your body needs them. But in the, you know, I like doing the nutrition beforehand because, you know, keeps you healthier. But if your body, for whatever reason, whether you're not sleeping or you're working too hard or you're more stressed out and you feel like, and everyone knows when they're starting not to feel good, that's a great time to elevate those botanicals in your system. Is that a lot? Hopefully not too much.
No, it's all what you said. You know, it's like you're talking about things that we all have in our houses, onions, and you know, those food is medicine. It's just knowing how to use it, and then that's, you know, that's where you come in, or people can do the research. But I learn from you every day. You last week you said you spoke about selenium, and then you said, oh yeah, you can just get that from Brazil nuts. I mean,
You
who knows?
can. Yeah, you know, like, yeah, you eat 2 Brazil nuts a day, you have enough selenium. You don't even have to go out and buy the pill. You know, and again, it's exactly that. It's knowing how to use nutrition to optimize your health. I mean, the reason why a supplement is called a supplement, and I've said this a million times in my lecture, it really is a supplement to doing everything else. You know, first and foremost, you have to get great quality sleep. There's nothing that does better for your body than sleep. You know, and then of course, number 2 is doing exercise. You know, I know gyms and fitness centers are closed, but even going for a walk, you know, going for a bike ride, getting outside, doing some, you know, isometric exercises at home, very simple things that you can do for yourself. And then getting good, high quality food, you know, foods that are mostly organic, you know, eating meats that are organic, grass fed. You know, the Environmental Working Group, which is the website ewg.org, has a great list of vegetables and fruits that are more pesticided for every single year. So a simple thing is, look, you know, if you can't afford always buying organic, that's fine. Go to ewg.org and say, okay, these fruits and vegetables really are the most important, where I do want to spend my money getting organic, where everything else doesn't have to be organic. You know, just try to keep things as clean as possible. But the more that you make your own food and you know what good quality oils that you're using and good quality ingredients, that alone increases your antioxidant status and does wonders for your health.
Such good information, and so, you know, easy for everyone to access.
Mm-hmm.
But if so, I know you're still practicing. A lot of your clients are calling you via Zoom, and you know, so I'm going to put contact information underneath. But what's the best way for them to get hold of you if people would like to have a session with you?
Yeah, I mean, we definitely, you know, go to our website too and sign up for our newsletter, because we are always trying to put out webinars as well, like we're doing free webinars as well, just updating everyone on COVID and great new information of what they need to be doing. But you can go to www.innersourcehealth.com. That's INNERSOURCE health.com. It has our phone number on our website and our links to all our social media. Because again, we're always putting out, you know, just regular good information about whether it's about COVID or just about mood issues or lung issues. Like all of our associates does a great job, and everyone has their own little specialty that they're talking about. And by all means, I think it's really what I'm really proud of, you know, not because it's my office, but the people that I work with, is because we really do try to put out great science-based information. And I just feel that, you know, when you could have a relationship with a practitioner that you could feel grounded and trust in, you're only going to do well. And I feel that, you know, gives you your own sense of power to understand that, you know what, I can do this.
Absolutely. And you see, everybody, why Dr. Oz calls Dr. Pina a world-renowned expert on natural medicine? I do. I see that clearly. So, Dr. Pina, thank you for your time. You know, I wanted everyone to see, you know, who you are and what your practice does. And I've personally experienced you and feel so grateful, because the information you give us is so important, more so now than any time in our lives, but for ongoing, you know, this is a time for people really to evaluate, is your medicine working for you? Is your doctor working for you? And that's a question, you know, we can only ask and answer ourselves.
Great. Absolutely.
So, yeah, so that, you know, if there's something that people have resonated with what you said, everybody, I know Dr. Pina is available, and so is her practice. And thank you, love, for your time. And
oh, thank you so much, Wendy. Thank you for being extraordinary. I really am. I'm ever so grateful for you.
Aw, touch my heart.
You're the best.
Take care, honey. Goodbye.
Thank you. Lots of love. Take care. Be well.